Asthma affects over 4 million adults in the UK, so managing asthma during pregnancy is a common experience shared by many women. It is easily managed and you can continue to use your prescribed asthma medications. In this short video, we'll explain how asthma can affect your pregnancy, how pregnancy can affect your asthma, what you should do differently, and what you can expect during pregnancy and labour. It is important to remember that your midwife will support you through your pregnancy, but your GP, asthma nurse, or specialist will continue to manage your asthma care. How could my asthma affect my pregnancy? Asthma medicines are safe to use in pregnancy, and if your asthma is well controlled, there's little to no risk at all for you or your baby. Asthma can be associated with your baby being born before 37 weeks. If you are admitted to hospital for your asthma during your pregnancy, you will be carefully looked after, and your consultant team will provide personalised information to support you with any decisions during your pregnancy and the birth of your baby. How could my pregnancy affect my asthma? The majority of women who have well-controlled asthma outside of pregnancy will continue to do so whilst pregnant. If you have asthma, it's hard to predict whether your symptoms will be any different in pregnancy. In fact, 1/3 of pregnant women experience an improvement in their asthma. 1/3 get worse, and 1/3 don't change at all. One common symptom during pregnancy for all women is acid reflux, which is when stomach acid travels back up towards the throat. For some women, this can make asthma worse. It is safe to take Gaviscon or omeprazole in pregnancy to relieve acid reflux, and these should be taken as per the instructions on the bottle or packet. What should I do differently during pregnancy? You shouldn't do anything differently during pregnancy to manage your asthma. You should continue to take your prescribed asthma medications, keep scheduled asthma reviews, and report any changes to your GP or asthma nurse. You should let your midwife know at your booking appointment that you have asthma. They will write this in your maternity notes and will refer you to be seen by a consultant-led team in an antenatal clinic, where you can talk more about any concerns you might have about your asthma. If you smoke, you should stop, for both your asthma and your pregnancy. There are very good support groups to assist with quitting smoking whilst pregnant, and your midwife can refer you. And lastly, you should keep up to date with your flu vaccination or any other vaccines recommended at the time of your pregnancy, such as for COVID-19. What should I expect during my pregnancy? If your asthma is well controlled with your prescribed medication, then your community midwife can provide your care during your pregnancy. If your asthma is poorly controlled or it gets worse during pregnancy, then it's likely that you'll be seen by a consultant team to monitor you more closely. You may also have a review by an anaesthetist. If you have severe asthma, you'll be offered extra scans during your pregnancy to check the growth of your baby. If you are one of the women whose asthma does get worse during pregnancy and you have an asthma attack, then the medications we would use to help you would be the same as if you weren't pregnant. During labour, the risk of an asthma attack is very low, and in the majority of cases, your asthma should not affect your birth experience and the safe arrival of your baby. Your midwife and an anaesthetist will discuss your options for pain relief during labour with you, and an epidural or spinal anaesthetic are both safe for women with asthma. Otherwise, you should continue to use your normal asthma medications during labour, the same as you have been using during pregnancy. Following the birth of your baby, breastfeeding is encouraged, and this will not affect or be affected by your asthma. It is safe to continue to take your asthma medication whilst breastfeeding alongside other common painkillers like ibuprofen and aspirin. When should I seek help? If your asthma symptoms get worse during your pregnancy, you should call your GP, asthma nurse, or 111. These symptoms could be using your reliever more than usual, coughing or wheezing more, especially at night, and feeling a shortness of breath or tightness in your chest. If you suffer an acute asthma attack, call 999. And if you're admitted to the hospital with your asthma, make sure you let your midwife know. To recap, most women who have well-controlled asthma outside of pregnancy will continue to do so whilst pregnant, and only about 1 in 10 or 10% of pregnant women have asthma symptoms during labour and birth. Your asthma could get better, stay the same, or get worse during pregnancy. You will be closely monitored and cared for throughout your pregnancy by your midwife and specialist team. Let your midwife know that you have asthma so the right care and support can be provided. You should continue to use your asthma medications during pregnancy, labour and when breastfeeding. Speak to your GP, asthma nurse or call 111 if your symptoms get worse. If you're ever worried or have any questions or concerns, contact your midwife. Thank you for watching. This educational video was created by the West Maternal Medicine Network.